here, which Keiki started, was he basically.
Can you put the microscope?
Microscope.
Yeah,
I want.
No, we have
You
got
continue, Keiki.
Microscope is on?
Is the microscope signal on?
Yes, sir.
Yeah,
It's on. It's on, Amar. It's very clear.
Yeah.
You can go ahead.
So basically what Keiki started was, so many years back, I think Keiki is first of all the pioneer of phacosurgery in India. And with this lens saluting technique, his concept is to do a good rhexis. Once you do a good rhexis, the next step is to do a good hydrodissection. And when you do a hydrodissection, the lens will tilt. When the lens tilts, it becomes like a saluting technique. So in other words, the nucleus has saluted. Now the advantage in this is, it has partly come out of the bag, partly in the bag. Today, I tell you honestly, Keiki, this is the technique I follow and whole group follows here.
Amar, but the problem is you need to have a slightly larger rhexis for the lens solution.
I don't agree. I used to think so when I used to see Keiki operate so beautifully, but now I'm able to do it with not a very large rhexis. But one thing I advise is I use an air pump always, Mohan. So the advantage in that is I am away from the cornea and I'm away from the posterior capsule. But you'll see when Keiki does it, how nicely he will show this particular technique of his lens saluting technique. I have with me Mahipal also here. Mahipal, you are doing a lot of these techniques of divide and conquers, stop and chops. So many other techniques are there. We were discussing Keiki's saluting technique, which I think is a great technique, which he has mastered and taught everyone. Tell me something on it.
Well, I think Keiki is one of the pioneers in phacoemulsification, and this is a technique where he's made this technique as also the coring technique, I think, wherein he cores the nucleus. And the advantage of this particular technique is the fastness with which he can do this procedure, and the ability to be able to chop the nucleus pretty well. Mohan, you were saying something about it?
No, I was just thinking, because if you, especially not in cataracts like this, it's about grade 2 cataract, what you're seeing now.
I have purposely made a small rhexis.
More brown cataract, grade 4, grade 5.
Okay, Keiki has made...
Purposely, yeah, go ahead.
He's made purposely a small rhexis, but what he's asking is that will it work for grade 4, grade 5 cataracts?
You know, Mohan, you have a lot of these diabetic patients, and I tell you honestly, I've got this karate technique, chop technique, which I've done, straight chops. I'll tell you honestly, this technique, now look at him. He's just tilted it, and once he tilts it, you see it's partly out of the bag. But the one thing is, I use an air pump, or Keiki is taking the bottle very high. With the air pump, what happens is...
Ask him to look in the light. Look at the light.
When the patient...
Center. Yeah, center the eye.
Now you can see now, he's not made a large rhexis, and even a dense cataract, Mohan, if you have these diabetic patients, small pupils, they make a lot of difference by this technique. Now you see, now what he has done here is, once he has tilted that nucleus there, he goes in with the...
Dr. Amar?
Yeah.
Can you center?
But Amar, the problem is you do a hydrodissection,
yeah,
and lens salutes,
yeah,
then it is okay. It doesn't salute if you keep on hydrodissecting.
Yeah, this is a good question.
You will get an acute capsular block syndrome there.
Correct, agreed. So this is,
you can have an hydro rupture.
I think the answer for that is you should have many ways to skin a cat, as they say. So basically the system here is, if it does not work, you can always do your other techniques. But right. I do feel that this technique is an excellent technique which Keiki has started.
It's a beautiful technique, there is no doubt about it. I'm not disputing the fact that it's a good technique. But what I'm trying to say is whether we have to have a larger rhexis for especially brown cataracts.
Now you see he's on a pulse mode with the Zeiss phaco machine.
Two.
This is a micro pulse, no?
Yeah, go back to one place. Yeah.
Can you say, just tell the parameters, what you're using?
What are the parameters, Zeiss people? 350 vacuum. 350 is the vacuum.
30 is the power.
How much is the power?
20.
30 is the power.
Let me remove the bubbles.
And flow rate?
What is the flow rate?
Mission, no?
28 is the flow rate. And you see now he's embedded it inside. Once he's embedding in the left hand, he's chopping that nucleus.
This is the external camera which is on now, Amar.
Please give me the microscope camera signal.
Yeah, it's okay now. So you're using the micropulse which is there in this eyes.
That's right.
Machine?
That's correct. He's using the micropulse. And this machine is an excellent machine. I've been using it for the past 2 weeks here with me. And I found that machine really excellent. So we thought we have to show.
2.
Amar, the picture is not very clear. I don't know why.
No, this patient is moving a little bit because my pulse thing was focused.
Are you not getting the colors?
We're not able to see the red glow.
Okay, that will.
Well, you are in good company. Even I don't have much of a glow.
No, that is because they made it into.
Have I? Acha, then alter it.
He's
Then.
made it partly paraxial, Keiki,
Okay.
the microscope, you know.
They wanted it more light, na?
Yeah, for getting more light, what they've done is they made the microscope illumination partly paraxial. So you see now he's finishing up the last pieces of that nucleus.
No, not yet.